Now, for another consideration which we are looking at as related to radiography, we are trying to look at the central ray. Okay, so ray is basically that light that's the radiation energy that is reaching the patient. So it's always nice for you to just place it and direct it just to the side where you want to image. Okay, I think they call that collimation. Okay, so that it will reduce how that patient is just exposed to radiation anyhow. Do you understand? So placement and direction of central ray radiography is a very important step. So it determines whether the anatomy of interest is properly visualized and minimize you come and have an image that is not clear. Okay, leading to things like you have imaged the patient but you have to image again simply because the image was not clear. So what's the definition? The central ray is the center of the X-ray beam emitted from the tube. So it is the most accurately defined portion of the beam and should be directed to the center of the anatomy that is of interest. If I want to image the chest, I must actually direct it to get a very clear image. If not, so placement of the central ray is you are always aligning it with the structure that is being examined. If it is in the chest, it is directed at the level of the T7. If it is abdomen, directed to the iliac crest. If it is a skull, directed to the mid cranium. If it is extremities, then basically you directly to the bones that you want to actually visualize. So you always keep it like that because you don't want to miss out the disease, you don't want to have images that are not clear and a lot of things, and you don't want to have a half image. That's basically an anatomic cutoff. Okay, so you direct it very well. So direction of central ray is could be perpendicular. So the central ray is usually directed perpendicular. So it's angle. It could be angled. Okay, it could be anterior posterior, where you are directing it from the front to the back. It could be the lumbosacral spine, side. Skull projections. A lot of it. Then also it could be parallel. Okay, so I think basically this is what we have, and most of the times emphasizing on the importance, right? So you should make sure that your patient is positioned rightly. You should also take note that not all anatomical structures are the same in all patients, so you have to put that variation and always arrange it individually. Do you understand? You must know the projection that you actually want, and you must know, how will I put it? You must know the reasons. You must know what you want to diagnose. Of course, the person requesting for the X-ray should give you at least an idea on the diagnosis, so you are just working alongside the diagnosis that was written before.